There is a benefit to getting the fourth dose. Yes, we are getting into a law of diminishing marginal returns, which means we are going to have to update these vaccines at some point to better reflect the circulating strains. And that's the whole conversation for what's going to happen in the fall. But yes, there is a benefit to getting a fourth dose, especially in high risk individuals, because COVID is still making people sick. It has not gone away. So it's important to look at the data accurately, to not overstate the benefits, but it's important not to understate the benefits either. And we do sometimes fall into this trap of minimizing the impact that COVID could have on our population, because it seems like every wave there's somebody saying, don't worry, it's going to be fine. And it turns out to be not that fine, all things considered. I completely understand why parents are worried. We're always more worried for our children than we are for ourselves. But this vaccine has been tested, and it hasn't been tested in a small number of kids. It's been tested in thousands of kids. Your child is not going to be the first one to get the vaccine. They are going to be child 6,000 and something. So this has been studied. There is quite a bit of data showing that, number one, the vaccine is effective, and number two, that the vaccine is safe. A lot of the things that people have heard out there about vaccine safety is not actually true. This whole risk of myocarditis, this was predominantly seen in adult men between the ages of like 20 and 25. This was not a pediatric situation. We talked about young men. We were talking about men in their 20s. So this is not something that has affected children. It was primarily seen in the US, where the first and second doses were a little bit closer together than they were here. So this is not something that's going to affect your children. We haven't seen the myocarditis thing in the pediatric population when we vaccinated the older age groups of children. The whole thing about fertility was not based on facts in any way, shape, or form. It was completely false. So a lot of these claims can be debunked. And so that's the thing. It's fine to have questions, but you have to be willing to accept the answers. And that's why, we do this. We do this to explain to people that, no, the risks are not there. So you can get your children vaccinated, because while your children are certainly at lesser risk for getting a severe complication from COVID, that risk is not zero.